Walking Stick Library presents Transhumanism versus Cystic Fibrosis with your librarian hostess with the mostest, Eileen Kramer. And don't forget, you can catch this stream live on Twitch.
Tonight's topic is vaguely inspired by Anna Mahalshia and her friends. We're not going to watch her intro. I promise you we're not watching it. Because she doesn't like transhumanism. We don't have to hear her calling it satanic for the 20th time. We just don't. But we've done some streams on... we've done some streams... I am sorry, folks, but... We have done some streams on transhumanism, and why wouldn't you want to be a transhumanist? I mean, when you think of they want a better humanity, they want to use technology, hey, I'm going to have my left hand back. I have it back partially now. Thank you to surgery with bolts and a plate. That's technology. I have two eyes that can see. They do not work together, but they can see due to glasses and ointment and somebody who cared. And a very simple test that they give to all children in school now. They catch them when they're 5 years old. If they haven't caught them, if the parents don't catch it sooner, they catch lazy eye in children. It's a very simple eye test. They test one eye, they test the other. If the scores are wildly different, the kid gets a referral. So it's a very basic screening. But somebody cared enough. I'm either a COVID super dodger or the vaccines really worked in my case. I've never had COVID. Thank you. And yes, I had some adverse effects. In fact, among the group I run with, that's what's going on here. In fact, among the group I run with, I was the sickest of the lot. I barfed all over the Avondale Station platform when I got my first Moderna shot, and I would not let anyone drive me to get the second one because I'm not throwing up in your car. You don't need to have me do that on you. That's not what friends do. I'm better off throwing up anonymously somewhere. God, you don't vomit on people. But yeah, I mean, there's a bottle of Coke syrup in the house, and there's Dramamines in this house for the next time I go get a COVID booster. They make me nauseous. Give me a very upset stomach, among other things. I don't get laid out by the fever. I just get an upset stomach and get motion sick really easily afterwards. So that's the, we've all benefited. And if you don't have technology, what takes over is, I'm going to drop my curtain. Right over here. Drop my curtain, minimize. What takes over is do. And we really do need a better font than what they give us. We need a different color than we usually have. Yeah, that is not something you want taking over. And if you do not believe that you don't want that being in control, we're going to look for something that's important. And I'm changing our colors back to our normal color. This little bugger over here. This is a mutation. It exists naturally. Let's get everybody on the same page. Right over here. right over here. And we'll just take something very basic. Make sure we all understand what we are talking about here. Cystic fibrosis. And over here, we're going to look in, we could also look in Medline Plus, even better. And we're going to do it this way tonight because the library changed interfaces on us again. And you don't want to know what's going on in there. We will ultimately get over there and have a look. Let's get a Google page up. And we should be able to do, and I'm sorry if you know what this is. And the and is implied, but we want the overlap between these areas. Here we go. Nice overlap. Good color for tonight. I am going to check to see who's in my squawk house. Nobody but me, oh, and that's fine. Cystic fibrosis and Medline Plus. Here we are. And cystic fibrosis is an inherited disease characterized by the buildup of thick, sticky mucus that can damage many of the body's organs. This disorder's most common signs and symptoms include progressive damage to the respiratory system and chronic digestive system problems. The features of the disorder vary. The features of this disorder and their severity varies among affected individuals. Mucus is a slippery substance that lubricates and protects the linings of the airways, digestive system, reproductive system, and other organs and tissue. In people with cystic fibrosis, the body produces a mucus that is abnormally thick and sticky. The abnormal mucus can clog the airways, leading to severe problems with breathing, bacterial infections in the lungs. These infections cause chronic coughing, wheezing, and inflammation. Over time, mucus buildup and infection results in permanent lung damage, including the formation of scar tissue, fibrosis, and cysts in the lungs. Most people with cystic fibrosis also have digestive problems. Some affected babies have meconium ileus, a blockage in the intestine that occurs shortly after birth. Other digestive programs result from a thick buildup of sticky mucus in the pancreas. The pancreas is an organ that produces insulin, a hormone that helps control blood glucose levels. It also makes enzymes that help digest food. In people with cystic fibrosis, mucus often damages the pancreas, impairing its ability to produce insulin and digestive enzymes. People with problems with digestion can lead to diarrhea, malnutrition, poor growth, and weight loss. In adolescence and adulthood, a shortage of insulin can cause a form of diabetes known as cystic fibrosis-related diabetes mellitus. Cystic fibrosis used to be considered a fatal disease of childhood. And I want to stop here. This is a story written by Frank DeFord about his daughter who died of cystic fibrosis. There's his daughter. Let's keep going. With improved treatments and better ways to manage the disease, many people with cystic fibrosis now live well into adulthood. Adults with cystic fibrosis experience health problems affecting the respiratory, digestive, and reproductive systems. Most men with cystic fibrosis have a congenital bilateral absence of vas deferens, a condition in which the tubes that carry sperm are blocked by mucus and do not develop properly. Men with CBAVD are unable to father children unless they undergo fertility treatment. Women with cystic fibrosis may experience complications in pregnancy. Cystic fibrosis is a common genetic disease within the white population in the United States. The disease occurs in every 1 in 2,500 to 3,500 white newborns. Cystic fibrosis is less common in other ethnic groups, 1 in 17,000 African Americans and 1 in 31,000 Asian Americans. The condition is an autosomal recessive pattern, which means that both copies of the gene in each cell have mutations. Parents of an individual with an autosomal recessive condition each carry one copy of the gene, but they typically do not show signs. And this is from mutations in the CFTR gene. Okay. And we have additional information and sources. And here it talks about the gene again, and there are various bad alleles of it. You can see these are the genes. This is FG2RA, and this is cystic fibrosis. This is CFTR, and it's an autosomal recessive. And this is a modifier of it, TGPB1. So there's 3 genes that are involved in this. Should say the frequency. If you want to get the frequency, we can take the square root of 2,500. Okay, so this shows how this works in a different way. And there are variations of this gene. Okay. So you're looking at about, with 1 in 2,500, square root of 2,500 will give you the frequency of the gene in the population. And that is because when you do genetics, you have what they call a Hardy-Weinberg equation. I'm going to write this out for everybody. A squared plus 2AB plus B squared. That's the classic one. It may not quite be that. So to get B, frequency of B, that's what we have to do. So we can get square root of 50. Square root of 3,000 is what? So approximately, according to them, 1 in 50 people carries this gene. You have 1 copy, it doesn't do anything. You have 2, you're very sick. Now, do we want to let this run wild? Come on, folks. You know how I feel. Okay, what we want to have happen, what we want to do is we want to look for the therapy for this. Let me get us to 100% again. And what we can do is we can, like this. Now, I did a little work earlier tonight, and there is a new drug to treat cystic fibrosis and not just leave it up to natural selection. And that drug is called Trikafta. It's a combination of drugs. So we can look for cystic fibrosis and Trikafta. And the place we're going to do that, because I am a brave sucker, is Medline. And we're going to have to live with how that database works tonight, because it's not going to work well. They are still getting the bugs out of the catalog. People are finishing up their term papers. God help them. This was not the time you want to be doing this. Thank you. I am glad I no longer work for my former employer sometimes. So let's get it going. We're going to go to GSU Library. And we're going to let ourselves in. And we're going to click M. And scroll down to Medline plus full text, and it's not going to look like it. That's not where we should be, number one. Do you all see that? We're going to have to change this. Medline plus full text, select. Now we're not going to be an academic search, complete, select. That's better. And we don't want natural language searching. We want cystic fibrosis. Actually, let's do it backwards. Try CAFTA, add cystic fibrosis, because you know an and search works in two directions. Let me see who's in the house tonight. Nobody. Okay, I'm still going to run this. I don't care. Let me run it and see what we get. That's not what I want to run. Okay, let's run this. You have to click this. I don't want a natural language search for a whole lot of reasons. I also want access to the thesaurus, which we don't get. Oh, we get it over here. Oh, that's really nice. Okay, we can take a look. No results. Okay, we're going to go back to running the search. It works well the way we're doing it. Okay, so this is 2023 now. Do we want to see the newest stuff? I've got 119. I just want more space. Can I have more space? Okay, what I want to do is switch this to the last 5 years. That brings us to 115. And I'm going to try sorting them date newest. Okay, patient with cystic fibrosis, not diagnosed until age 23. Started with Trikafta. Trikafta rescues 508 delete CFTR by tightening specific phosphorylation-dependent interdomain interactions. Okay. The impact of cystic fibrosis transmembrane conductance regulator, CFTR modulators on the pulmonary microbiota. That test factor, and okay, so we have a different one here. We could access it if we wanted. This is a different set of drugs. But Trikafta does not help everybody. And it looks like we do not have access. Not tonight. Okay. Let's strategies to use CFTR modulators in countries without reimbursement agreements. Okay, evaluating. Okay, this is for a different disease. What I think I want, now that I'm looking at all of these, is something a little more 10,000 feet up. So what I'm going to do is put this back on all time, and I'm going to look at all filters and see if I can find what I'm looking for. Is there an article type? Not going to give me much. Okay, we have another method. We want something that's going to kind of give us the 10,000 foot view. So what that is a review article. And this, by the way, has some other names. So let's fix that while we're here. CFTR modulator. That's one right there. So we know what that is. And over here, we're going to put another circle. I'm going to move that circle so it fits better. And what we're looking for is a review. Not a book review, just a review. This is what we're going to have. Nice purple center for a change. And we'll fix this because this is a synonym. So when we picked up through a close read, and we'll tuck it in like that. And we'll take a look. And we can go back and run this again, just add the review. Let's see what we get. Okay, that's one. That's okay. I'm looking for review in the title. Okay. Okay, I'm still not seeing it. Okay, but this looks good. One size does not fit all. The past, present, and future of causal therapies. It's a 2022, but let's have a look. We've got a PDF. Here it comes. And it looks beautiful. Okay, this is in what? It's in Cells. It's an MDPI journal, but I think this one's decent. And this is what the abstract says. Cystic fibrosis. Let me take this down, and I am going to do another very quick chat check. I like to torture myself. I really do. Cystic fibrosis is the most common monogenetic disorder caused by mutations in the CF transmembrane conductance regulator CFTR gene. Over the last 30 years, tremendous progress has been made in understanding the molecular basis of cystic fibrosis and the development of treatments that target the underlying defects in CF. Currently, a highly effective CFTR modulator treatment, and they call it Kalydeco or Trikafta, is available for 90% of people with cystic fibrosis. In this review, we will give extensive overview of the past, the ongoing efforts in the development of therapies targeting molecular defects in cystic fibrosis. We will discuss the strategies targeting the CFTR protein, i.e. CFTR modulators, such as correctors and potentiators, its cellular environment, the proteostasis modulation stabilization in the plasma membrane, the CFTR mRNA amplifiers, i.e. amplifiers, nonsense-mediated mRNA decay suppressors, translational read-through inducing drugs, or the CFTR gene therapies. Finally, we will focus on how these efforts can be applied to the 15% of people with cystic fibrosis for whom no causal therapy is available yet. I hear my target going taka 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 taka. So that's very definitely the kind of thing we would want. Let me take us back out. What else can we harvest from this? Woo! A review of Trikafta triple cystic fibrosis transmembrane. This is exactly what we'd be looking for. And yes, it's Cureus, which isn't the greatest journal place, but we don't really care, as long as we get the journal. And here we have another one. This is an even better one. And yes, we want more. We don't just want 10 results. This one didn't go in, and I'm going to leave it alone because this one's a better publisher. We don't need this. I'm taking this down. We can just click access now and we'll get in here. And this is it. Right here. Now this is a little old. But it's there. And here we have it. And it's 3 drugs. Elixacaftor, tezacaftor, vacaftor. XLTEZVIA is a new cystic fibrosis transmembrane conductance regulator modulator treatment used over the last few years, which has shown an improvement in differential outcome. I don't think this is, this is Trikafta. Okay, so Elixacaftor, tezacaftor, and ivacaftor, ELXTEZIVA is a new CFTR cystic fibrosis transmembrane conductance regulator modulator treatment used over the last few years, which has shown an improvement in different clinical outcomes in patients with cystic fibrosis. The objective of this study was a systematic research of the literature on the efficacy and safety of the CFTR modulator on patients with CF. A search of PubMed was conducted for randomized clinical trials and observational studies published from 2012 to September of 2022. These included full manuscripts, comprised 9 clinical trials and 16 observational studies whose patients were aged 12 years or over or were children 6 to 11 with at least one PHE508 deletion mutation and or advanced lung disease. These studies showed that Trikafta has a significant positive effect on lung function in patients with CF by ameliorating parameters such as FEV1, LC1, pulmonary exacerbations, sweat chloride concentration, increasing body mass index, these kids get very skinny, and improving quality of life. Its role in cystic fibrosis-related diabetes is not yet clear. It was found that this new CFTR modulator has an overall favorable safety profile with mild to moderate adverse effects. Further studies are needed for a deeper understanding of the impact of CFTR modulators on other CF manifestations. As in, wow. If you were an English student and you need a scholarly journal article, you have landed on the gold mine. And if you need more than one, since we are looking at how this works and that it works, you've got your little miracle cure here. Not quite a miracle cure, but close enough. Down here, we've got the references. And you can pick and choose. So you could grab this one. The Future of Cystic Fibrosis Care in Lancet. Oh, you're a happy student. And again, here we have the past 6 decades have seen remarkable improvements in health outcomes for people with cystic fibrosis, which once was a fatal disease of infants and young children. Remember this picture, folks. Furthermore, epidemiological studies in the past 2 decades have shown that cystic fibrosis occurs and is more frequent than was previously thought in populations of non-European descent, and the disease is now recognized in many regions of the world. The Lancet Respiratory Medicine Commission on the future of cystic fibrosis care was established at a time of great change in the clinical care of people with this disease, with a growing population of adult patients, widespread genetic testing supporting diagnosis, cystic fibrosis, and the development of therapies targeting defects in cystic fibrosis transmembrane conductance regulator, which are likely to affect natural trajectory of the disease. The aim of this commission was to bring to the attention of patients, healthcare professionals, researchers, funders, service providers, policymakers, the various challenges associated with the changing landscape of cystic fibrosis care and the opportunities available for progress, providing a blueprint for the future of cystic fibrosis care. The discovery of the CFTR gene late in the 1980s triggered a surge of basic research that enhanced understanding of the pathophysiology and genotype-phenotype relationships. Pathophysiology is how you suffer, the mechanism by which you suffer. And student language. When a student is asking, I want to know how they suffer, they're either asking for psychological stuff or pathophysiology. And the genotype-phenotype relationship, which is genes to expression of this clinically variable disease. Until recently, available treatments could only control symptoms and restrict complications, but advances in CFTR modulator therapies address the basic defect of cystic fibrosis and have been remarkable, and the field is evolving rapidly. However, CFTR modulators approved for use to date are expensive, which has prompted questions about affordability of new treatments, and serve to emphasize a considerable gap in health outcomes for patients with cystic fibrosis between high-income countries and low- and middle-income countries. Advances in clinical care have been multifaceted and include earlier diagnosis through the implementation of newborn screening programs, formalized airway clearance therapy, and reduced malnutrition through use of effective pancreatic enzyme treatment and a high-energy, high-protein diet. Thank you! That would be another one. And this is, again, we can try it at Google Scholar. And it sent you out, but that's okay. We have access. And here it is. Oh, access through my institution. Thank you. Let's hope all that works tonight. There we are. Didn't take. Let's try again. Not available. So this would be an interlibrary loan, unfortunately. And again, this is just a good one, even though it's older. Cystic fibrosis is the most common life-shortening inherited disorder in people of European descent. It also occurs in other ethnicities. The identification of the disease and the isolation of the causative gene, termed the cystic fibrosis transmembrane conductance regulator, and the improved survival from comprehensive multidisciplinary treatment is one of the success stories of modern medicine. Survival has increased dramatically over the last 50 years, from 10 years in the 1960s to 30 years in the 1990s to approximately 50 years and going onward. So lots of these here, you get to your pick. And this is another one, and again, we can get to this. It does take us outside. Nice. This is in the Lancet, just as in a different place. And this is an older one. But again, we're tracking it. So this would be a beginning. And if this is a little old, the other way to get around something like this is take it to Web of Science. We have a good last name here. We have our friend Capuni, Capuni N. There's not too many Capunis out there. So we could go back here, or we could go to Web of Science and see who in the last 2 years has cited this article. Remember, I've got an article here from 2023. I'd like to see the last 2 years, who cited it, since most likely they will be talking about what I'm interested in. I open up Web of Science. This was under W, Web of Science, right here, and I'm checking my house again. Who's in the house tonight? No one in the house tonight. And you can see I was playing with this earlier, but I want a cited reference. And this is Capuni. And poor Nicoletta Capuni, poor Miss Capuni. And we want cystic fibrosis in the title. Title's way down here. That's the only trick. And we're going to let it rip. And she's got a bunch of these, but she's right here. 30 references. This is just one that's not quite written the same way. And let's see the results. So this has been cited all over the place. And you can see they're trying all different things. This is one we did not get because probably I was searching under the common name. But this landed right on the money. They used a different common name here, but this looks really good. Let's get the full text at publisher. Remember, we're interested, we like stories. Real life in cystic fibrosis pediatric patients. In 2020, Kaftrio, also called Trikafta in the United States, a combination of elexacaftor, tezacaftor, and ivacaftor gained approval for treatment of cystic fibrosis in patients from the age of 12. This study aims to analyze one-year treatment of Kaftrio in pediatric patients, comparing their clinical characteristics with pretreatment data. This is an observational, descriptive, longitudinal study in patients with CF older than 12 with at least one 508 delta mutation treated with Kaftrio for 1 year. Forced expiratory volume, FEV1, Z-score increased by looks like 10%, from 0.55 to 1.64. That's impressive. Forced vital capacity, and again, increased from 0.10 to 1.04. Maximum mid-expiratory flow, again, big increases. In addition, a reduction of 25 points of chlorine in the sweat, so the sweat's not as salty, was observed. Body mass index for age Z-score increased by 39%. A transient increase in cough and secretions was noted. That's where they cough up the gunk. Was noted in 61.5% starting treatment. Kaftrio improves lung function and BMI and also reduces respiratory exacerbations and sweat chloride levels. Woo-hoo. Okay. And again, I'm looking more. Here we have the psychosocial impact. And again, this works pretty well. And it's BMC, so we know we're going to have access. After 12 months of treatment, significant improvements were noted in BMI, lung function, FEV1, and that's full expiratory volume from the lungs, and quality of life. However, anxiety and depression levels did not differ significantly during follow-up. When we stratified our sample by key groups, we observed that younger patients under 28 and those with homozygous PHE508 deletion mutations experienced significantly higher anxiety with no differences on depression. Furthermore, anxiety and depression demonstrated a moderate correlation strengthening over time. I don't know why. Maybe the damage was done. Maybe it's having to be on powerful meds. You're well enough to get along in the world, but you're not well enough to be really well. And it says here, however, despite positive outcomes, there were no significant changes observed in anxiety and depression except for individuals with the homozygous mutation type and those younger than 28. So it may be the damage is done. I do not know. I do want to come out and clean up in aisle 9. Thank you for watching. And remember, you can catch me live on Twitch.